Hi, and hello, Annie.
Hello.
I am so excited to be here with you for so many reasons. But I have to start with something that I wasn't planning on. Less than 24 hours ago, I learned a fact about you that has been living rent-free in my head. Your first job involved working on the Apple IPO? Explain, how did this happen? My first job was in a restaurant?
That is true. So, I got out of college, or at the time Silicon Valley was in its infancy. And the first 3 months, Steve Jobs took Apple public with this little firm, Hambrecht & Quist. And I was assigned to sort of carry his bags and take care of all of his needs and sit there between the two, when he argued with the founder about whether he should wear his T-shirt for the roadshow versus a suit,
What did he settle on?
Oh yeah, he wore his suit, but that was like 3-hour screaming match between the two.
So he lost the T-shirt fight, it sounds like.
The T-shirt contest.
But is there anything from that time that sticks with you?
Yeah. Oh, just, I was 22, he was 24, and the level of intensity, that stuck with me, is that I just want to work with entrepreneurs like this because his level of conviction and intensity and what he wanted to do and how to do it was just something that as 22 I did not have.
So I thank you. I've been obsessed with this fact. And it's one of the interesting things, I guess, too, is now you have been working with high conviction entrepreneurs in really high stakes areas, healthcare, fintech. Both are areas that have seen a lot of change, I guess you could say, in the last 6 months, in a space and a world that's seen a lot of change in the last 6 months. What do you think the biggest change since the summer is?
First of all, what hasn't changed in the last 6 months? I feel like the investment world. Certainly, the pace of change, and so many of you in the industry are like, we're experiencing it. I haven't seen anything move this quickly in my 30 plus years of investing. The pace of change has just been extraordinary in 6 months, where 6 months ago you thought there was a possibility of something being able to be done, like an AI doc. And now, 6 months later, it's a reality and is doing it better. Diagnostic is better than an actual doc. I think the pace of change on regulation. I spent a lot of time in Washington this week, and
how is it over there?
It's a bit of a freak show, but it is. It's like depends on what day, the good Trump or the bad Trump, and we had a good day actually. So we can talk about that. But I think there's going to be, if you think about crypto and fintech, which we'll get into, it is let 1,000 flowers bloom in fintech and in crypto. And, it's obviously the Biden administration had shut things down on that front. And now there's literally no regulation around it. So we're going to have to find a balance there. But it's interesting.
We're going to get into all of the regulatory conversation to be had, which we could fill probably hours with. Yeah. But before we do that, I think it's important to sort of draw the lines. On the face of it, some would say healthcare and fintech are very different.
Yeah.
What do they have in common?
I think, what they have in common is there's nothing more important than money or your health, right? In the end, those are the two essential items we really can't live without. And so we want, if I want to invest and we want to invest in something, make it meaningful, make it critical and essential to people's lives. So I think that's what they share. There are obviously also industries that are highly regulated, and we use that as an offensive and defensive lever. Just the knowledge and being steeped in it for so long. We understand how to navigate. We've navigated through 5 administrations, and so far, knock on wood, we haven't had a company go down because we invested. We chose the wrong path. And I think that if you think about like both of these areas, it's also just understanding the use case and understanding the customer. And so we're deeply embedded in a fairly concentrated set of customers on both sides. And these are also the buyers of these companies. We sell 80% of our companies to strategics. So they have actually a lot of similarities, including insurance, and let's face it, payments and rev cycle is embedded in everything. Yeah.
And because they're both so highly regulated, it means they're both sort of sensitive to macroeconomic and sociopolitical forces. We're less than 5 minutes in, but I guess it's time to talk about Trump. Why not, right? Let's start with the good, actually. Yeah. From a regulatory perspective, what do you think the Trump administration has the opportunity to get right?
Yeah. Well, I think you have to start from what's the base level we're walking into this with, and I think the Biden administration clearly did not only the appearance of anti-business, but actually they were anti-business. There was only one secretary in the entire cabinet that had a scintilla of business experience. And I think that created an environment that was not constructive, and certainly in the two areas that I invest in, I mean, between crypto and fintech, as well as healthcare, it was very hard because they were not about innovation. And so you're walking into this, and I think the Trump administration has an opportunity. They obviously have a sort of anti-corporatist, but definitely a pro-business bent to the administration, with a number of individuals in that administration that care about policy, but also are serious about supporting innovation in business. So, I think it will be. I think they have an opportunity to unleash in the fintech side. Good regulation, where you're protecting consumers and you care about the lending environment, but also to unleash crypto for all of its use cases, as well as give the fintech landscape a chance to bloom. And then in healthcare, they were decidedly anti-private sector, and clearly we saw that in Medicare Advantage. And if you think about Medicare Advantage, that is something that Dr. Oz, who's now head of CMS, who runs Medicaid and Medicare, Dr. Oz has said Medicare Advantage for all should actually be the law of the land, and I happen to agree with that. And it's an incredible playground for innovation because the average patient, consumer member is in it for 8 years. And then, so you can actually invest in someone's health, and be proactive and be preventative. So it's a positive. And I think that's going to be supported, whereas they were really trying to crush it in the Biden administration. Medicaid is fraud. I think you may have seen this morning that they actually announced that the House did get some legislation passed. There's so much that actually needs to be defined. There's not much defined in it other than the level of cuts. But they are going to go after Medicaid. Again, I was there, I guess, Saturday, and there's no question that Medicaid, the states are either going to have to take people off the rolls, or they're going to have to supplement with billions of dollars to actually continue to cover people. And I think that'll interestingly be a problem for the Trump base.
Now, I want to go back to something you said, because the way you phrased it seemed quite specific, that the Biden administration, you didn't feel as though it was just the appearance of being sort of anti-business. Is that fair? It was the reality of it. Why that specific phrasing? And also, note for all of you, it is actually a little surprising that coming from you, given that you are the First Lady of Connecticut, a Democratic state.
That is true. But I'm also
so glad I got that. Person. Yeah, so glad I got that right.
Yeah, that is true. So I do have, obviously in socials, I do have a bias to the Democratic side, but the reality is when it comes to legislation, I think where most Americans sit is we have to have a constructive business environment. If you want to grow GDP, if you want innovation to occur, then you have to understand actually how business works to foster that. And I think there was a lot of Democrats have an issue where they drive things from policy perspectives and not actually living in these domains. And I think the combination is what's absolutely necessary. And I think most people are social liberals or even libertarians, but then when it comes to their work lives, they actually want a government that is supportive.
So if you had to distill it down, if there's one positive regulatory change you're expecting to see from the Trump administration, what is it? What should we keep an eye out for?
Well, I think you've already seen it in crypto. I think we're gonna lurch from one extreme to another, right? We're already seeing more fraud. Probably should be banning meme coins, but I'm not sure that Trump and Melania are gonna do that right now. But I do think that Medicaid you are going to see a change in Medicaid, no question. 340B, not to get too specific, but is about all hospitals buy discounted drugs, and I think that possibility is going to be eliminated for major urban hospitals, and is going to be the initial intent of that program was to support rural hospitals. And those that could not, federally qualified health centers, and those that could not afford drugs at the general wholesale prices. So I think that is probably going to change also. So things that would affect our industries. Yeah.
Now let's get to the things that you're concerned about. In terms of sort of regulatory change you're expecting under the Trump administration, what are you most worried about?
I think what you have to worry about is the uneven enforcement of regulation at the end of the day. And I think the thing I worry about is allocation of dollars to states and punitive behavior to states across the country, so that one can interpret laws however they want to interpret it, and then basically punish people if the behavior is not what they would like to see. So I don't know if that's fascism, but I think that's what people would need to worry about, right? I think the reality is I think intent of most of the policies are constructive. I mean, honestly, energy, like very constructive. And so I'm very my errors, but I actually know energy very well, being the first lady of Connecticut, because we have the highest electricity rates in the country. And so,
Connecticut has the highest electricity rates in the
because
country?
we're landlocked. We can't get oil from Pennsylvania. We have to bring it in. Massachusetts won't allow us to get hydro from Canada. So it's very challenging. And so we want to get more oil from the monarchies in Pennsylvania. And honestly, the Trump administration is being extremely constructive on that. So I think that things they care about, like actually lowering energy prices and expanding the supply of energy, be it renewables or otherwise. That's something that Doug Burgum, the new Secretary of Interior, and the Secretary of Energy are positive about. So I'll give them kudos on that front.
When it comes to regulating fintech specifically, this is something I've been incredibly interested in, because the Biden administration's sort of tactic of let's keep fintech out clearly hasn't worked in terms of keeping consumers safe. Right. What do you think productive fintech regulation should look like, independent of what, this is purely theoretical, independent of what you think will actually happen?
Yeah.
Give us a blueprint.
Yeah. Well, I think the issue in government, whether it was the Dodd-Frank Act, or whether more recently, I think that the issue is that it should be extremely targeted. So when they created the CFPB, there should just be very specific codicils about, like, what is the goal? The goal is to protect consumers. And so, but that was interpreted extremely broadly and then regulated broadly. And I think that if you can just focus on the ultimate customer and what's the impact to the customer, then that can be very, that's super constructive. I mean, if you have a DOJ and an FTC that's focused more broadly on the definition of antitrust, then you're going after every big company that's trying to buy a company, right? And that isn't actually the definition. You are trying to protect consumers from abusive behavior by corporations. That's really the intent. And you worry about that in terms of monopolies. I mean, if the government was truly worried about monopolies, they should be worried about every hospital system in every town, right? Because they have monopoly. They're totally monopolistic, and the reality is payers have very little leverage in negotiating with local hospitals.
Well, and you touched on healthcare here, and I actually sort of want to ask directly, because I think healthcare is a space with a lot of unanswered questions. What do you think the biggest unanswered question in healthcare is right now?
Well, I think the biggest unanswered question that we're probably answering relatively quickly is the applicability, how far will AI go and how fast will it go? So as opposed to like focusing on the regulatory side of it, simply, what we thought couldn't happen 6 months ago is happening now, right? We're talking about if you're, a doc AI actually diagnosing someone more accurately than a doctor is.
It sounds like that rate of change really surprised you.
Today, pace of change. Yes, very surprising, because just think about it. We were talking about hallucinations 5 months ago, and now people aren't worried about hallucinations in terms of that particular application. And we are continuing to knock down all the issues, the barriers that people have put up around it. So I do think that is, and I have very sophisticated CTOs within healthcare companies. I mean, fintech companies, more tech-oriented individuals are driving these companies. So fintech companies, from a product perspective, are, I would say, more up to speed on AI and the most recent modern architectures. Healthcare companies, you've had to imbue that technology into healthcare companies. I think that's one of the biggest changes of the last 2 years, is that we were always investing in companies that truly understood healthcare, and then we would try to imbue technology into it. Right now, we're investing in many more companies that are product and tech-centric individuals. And the good news is they may have had an experience at a healthcare company in the past. So it is tech-driven, tech-forward in healthcare as much as healthcare forward, and that's new.
I want to pull this thread out a little bit. It sounds like that AI is moving differently in fintech as opposed to healthcare. It sounds like fintech companies are a bit more AI native, perhaps?
Well, I think fintech companies may be more AI native. I think the fascinating thing is, we all know that the deal flow has changed dramatically in the last, really the last 6 months.
How dramatically? What are we talking about?
here? Dramatic. Like literally, we're probably seeing 7x more real deals than we saw 2 years ago to look at. So it has changed, and partly that's AI. And I think partly AI is driven because companies are growing faster, so you didn't even know about the company 2 years ago, or it might have just started, and then all of a sudden it gets to a scale, that is really interesting for us to invest in, and you're seeing, success, right? But I think that the interesting thing is, with so much unstructured data in healthcare, you are seeing far more companies being created that are AI native, that are using AI in ways that one wouldn't have anticipated in workflow and clinical. And I think that's super exciting to me, because we always counted on fintech to be this, to educate the healthcare portion of Oak on technology, and the latest, greatest things that you were doing. And so we've relied on fintech to do that, and we've actually been seeing more AI native companies and AI use in healthcare than we have in fintech. I feel like fintech is almost catching up at this moment in time.
That's really interesting. So it's actually the reverse.
It's actually the reverse.
In this moment.
And it's partly because the customers are, for the first time, like, providers are open to it too.
When you sort of consider, one thing, I was thinking about something I read that you said previously, that part of being a VC is having to reinvent yourself across cycles. What has that meant for you, sort of through the AI boom especially?
The reinvention in the past has been, you're investing in biotech, and then there are 3,000 biotech companies and 4 that are public, and there are 3,000 public biotech companies, but 4 have approved product. And so you can just see that the next decade is not going to go as well. And so you start thinking, advent of the internet, invest in something like Athena Health was our first investment on that front, and that took us into cloud-based, AI and cloud-based software in healthcare. And so now it's just interesting, because I think the difference is that this conversion of being product-centric and tech-centric, and that is the change. And so we are bringing more technologists. And we do have more, on the fintech side, more engineers, more software engineers, more technologists on that side. But I would say in healthcare, we are having to shift to bringing in more product and tech-oriented individuals.
Now, I want to ask an LA question. We are at the Upfront Summit. I have to. I have no choice. I'm also an Angelino for the last 5 years, and I'm very invested in this city personally. One thing that came up was in our prep, you mentioned that you've been investing in LA more for the last few years.
Yeah.
Can you explain how that happened and why?
Yeah.
Give me some ammo here.
We follow where great entrepreneurs are, and great entrepreneurs are coming to LA. And I wanted to come here, one, the quality of the audience, of course, but two, there is a set of founders in this community that, in part, I think COVID brought some people here, which is interesting. And the reality is that we've invested. We had no companies here 4 years ago. We have 5 companies in LA now, and it is becoming an epicenter for great talent. So we want to build on that. So it's important that we spend more time here. We've got somebody we have an office in San Francisco and Connecticut, New York, but we're going to be here. We're here every month now, every couple of weeks. So it's exciting because I think there's a really vibrant founder community that's developed in LA, and it also has a history, more in healthcare than fintech, but a history of managed care here. It's frankly, if you know Northern and Southern California, you know that healthcare prices are much higher in Northern California than Southern California, and it's because of the history of managed care in Southern California. Yeah.
So it sounds like that makes it a good place to invest in healthcare?
Yeah, and good because they've been focused on value-based models and thinking about outcomes, and there's a lot of expertise here, but there's also, because of the universities and university hospitals, there's also, tech orientation. We have not done as much fintech here, but we are doing a lot of fintech in LATAM, so LATAM has been driving, frankly, our strategy at the moment.
So it sounds like we should prepare for a lot of regulatory change in the next couple of years. That seems fair. When you sort of think about guiding principles for navigating regulatory change, are there any that you'd want to leave the audience with?
Look, I think guiding principles when you're invested in highly regulated industries is just do right by the customer. And if you're in healthcare, if you're providing a better experience, if you're lowering costs, if you're focused on outcomes, and you're not worried about we didn't invest in exchanges when they first came out because we had to see how it played out. But I think if you do the right thing, generally regulation's not going to go against you. In fintech, we're focused on stable coins mostly with Circle and Paxos and Bridge that was just sold to Stripe. And if you're focused on things that have fundamental use cases and are not about trading it, then you're going to be fine in the long run. So it's kind of that long run view where you might have one administration that advantages you or disadvantages you in your Medicare Advantage, companies or in Medicaid or in crypto. But I think in general, if you just are focused on providing fundamental value, then you're going to be fine.
So do right by the customer and hunker in.
Yeah.
It sounds like.
Yeah.
Right. So let's imagine we fast forward 5 years. And I know I asked this question with an awareness that the rate of change is going to be substantial.
Yeah.
But what do you think the intersection of tech and politics will look like 5 years from now, give or take?
Well, one thing that's obviously happening right now that I think is super interesting is that, bringing all these technologists to Washington is incredibly important and vital. And I think we do need an entire revamp of, just like in our universities. The reality is nobody fires anyone, nobody rethinks anything until they have to. They just keep adding things. And I think the government obviously needs to completely reinvent itself from defense, through all the systems they're working on. The reality is the White House can't communicate with any of its departments because the White House, uses Zoom and everybody else in departments use Teams or something. And, they're bicycling documents and information back. It's insane. So I think coming in, and I do think in 5 years, if we can actually harness the power and talent that is being applied to this in the right way, you could have an extraordinarily more efficient and effective government. I think if personal greed and divisiveness gets in the way, then you're going to have this overreaction to it on the other side. And I think we have this sort of terrible tendency to, go from one extreme to another. and then it probably won't be great. And I think that you probably will have another administration that will be anti-business and find that business is evil. So I would
We will cycle through again.
and we will cycle through again. So I do not want that to happen. I want them to be effective in re-engineering government. I think in defense we clearly need that. Thinking about how we reinvent government and not have it be about your local senators fighting for this particular base and this particular company. I think it has to be about true talent and what's the strategic imperative. I think the strategic imperative around investing around the world, rare minerals in Ukraine, not all bad. So I think that's the intersection. I call it technology and politics, because I think if you just think about what's happening today, it really is about this is going to be a symbol of Elon Musk and the tech bros in government and what happened. And it's going to be either a force for good or a force for evil, and let's hope it's a force for good. I'm a venture capitalist, I'm an optimist, so I'd like to think it's a force for good.
We'll check back in 5 years.
Yeah, check back in 5 years.
Thank you so much, Annie.
Okay. Thank you.